This morning, we are continuing to recognize Mental Health Awareness Month, and one of the biggest impacts on our mental health is how much sleep we're getting.
Whenever we hear these sleep stories, that hurts us, right? But today we're specifically talking about our teenagers. A recent study says middle and high schools may be starting too early. Our wellness expert, Dr. Heather Hans is joining us this morning. Thanks for coming in.
Thank you for having me.
First and foremost, congratulations on your
Thank
PhD.
Thank you. I really appreciate it.
Dr. Hans has a good ring to it.
I know
right?
it does. You've been juggling so much. All right, so what do they say about high school students in terms of like how much sleep they actually need?
Sure. So the changes in the circadian rhythm of teenagers during puberty in all mammals actually causes them to go to sleep later and wake up later than people younger or older. And the amount of time they recommend is 8 to 10 hours, but only 30% of teens are getting that much. So the American Academy of Pediatrics has viewed this as a public health issue, and they strongly encourage schools to start no earlier than 8:30, middle and high schools. California became the first state this school year to enact legislation mandating these later start times, and there's 9 other states that have pending legislation. So I've seen, both as a mother of a teen and working with teens clinically, that this really does negatively impact their health to start this early. So it's up to all of us adults to protect their well-being.
Talk to us a little bit more about that, the consequences of not getting that kind of sleep.
Sure. So there's the obvious health and safety consequences. And so the early start times have been linked with substance abuse, poor impulse control, immune deficiencies, weight gain, mood fluctuations, even suicide ideation. Wow. And there's also a link between car accidents and teen driving during the early start times because of drowsiness. And those who don't drive are walking or standing in the dark typically. There's also problems with their academic performance. The early start times have been linked to truancy, tardiness, absenteeism, even dropping out. And it's also been found to make them slower to react when they don't get enough sleep, have poor decision making, be less motivated. And there's a study linking the later start times to improved standardized test scores. So, and one other point is that the U.S. as an economy suffers from this. The researchers have predicted an $8 billion increase to the economy after 2 years of later start times, and $83 billion after 10 years. And economists have even predicted that students themselves would get $17,000 more in income from this little change.
Mind-blowing how much is linked to our sleep.
I know.
We could be geniuses if we didn't wake up at 2 a.m.
How about all that? Yeah. I mean, this all seems like a no-brainer, like let's do this, but are there any drawbacks to a later start time?
Good question. I think people's main worry is just the upfront investment of having to change after-school activities, bus schedules, parents' work schedules, but really it will help teachers spend more time with self-care and with their families in the morning, and also administrators will be able to find replacements if people call in sick, and it coincides with parents' typical work schedules, so it should be better for them once the adjustment is made.
Yeah, a lot of downsides to not doing this, but it sounds like a lot of positives if you implement this. Also, I was wondering if that changes the conversation around daylight saving, you know, people wanting to keep that, because you were mentioning kids walking to school in the dark.
Good point, and I know that that's still up for debate, whether that's going to happen or not. So I guess we'll have to wait and see about that. But
I'm all for later start times too. I'm with you. Heather, thanks for coming in.
Thank
Dr.
you.
Heather
My
Hans,
pleasure.
thank you.
Thank you.